About delirium tremens. Delirium tremens. When does it present? How does it present? What's the treatment? So, when does delirium tremens occur? Delirium tremens is a severe manifestation of alcohol withdrawal. So let's picture a patient who is a chronic alcoholic gets admitted to a hospital for a surgery, and he does not have the chance to have some alcohol. So after 2 days of admission, he develops a severe withdrawal symptom or severe withdrawal syndrome. And that severe alcohol withdrawal syndrome is the delirium tremens. How does it present? To know this, look at the words delirium tremens. So delirium, the patient will have delirious features such as the patient's orientation will be abnormal. The patient will have a fluctuating level of consciousness. He will be disoriented. And sometimes the patient will be agitated and aggressive, very severe agitation. So disoriented, agitated. And the patient may have, as is delirious, the patient may have hallucination. Even the patient can have seizure. So those are the words related to delirium. Tremens, remember tremors. The patient often has tremors, seizures, and tremors. Along with those neurologic manifestations, the patient will also have some cardiovascular manifestation due to the overactivation of the sympathetic nervous system. So the patient will have tachycardia, tachypnea, and sweating. So increased heart rate, increased respiratory rate, and sweating. And sometimes the patient can have a high blood pressure. So tachycardia, tachypnea, sweating, and hypertension. All of those are commonly related with the hyperactivation of the sympathetic nervous system. So in summary, delirium tremens presents as delirium and tremors. Delirium, patient is disoriented, agitated, he is hallucinating, and sometimes he develops seizures and tremors. There is activation of the sympathetic nervous system leading to tachycardia, tachypnea, sweating, and hypertension. So how do you treat a patient with delirium? The treatment is very simple. There is a specific therapy and there are some general approaches. The specific treatment for delirium may be a diazepam, such as lorazepam or chlordiazepoxide. This is kind of like the first choice, but if the patient has liver disease, then lorazepam will be a better choice. And the dose of chlordiazepoxide is around 30 milligrams QDS, meaning every 6 hourly. General management for delirium tremens includes obviously a hospital admission. Admit the patient to the hospital and correct if there is any electrolyte imbalances. So correct electrolyte imbalances, give the patient fluid because the patients are often dehydrated. Treat any comorbidities because alcoholism is often a cause of precipitation of the comorbid illnesses. And another important aspect of treatment is giving thiamine or the Fabrinex because alcoholic patients who are developing the withdrawal symptoms often have a deficiency of vitamin B1. So give thiamine, and you also want to give glucose along with thiamine to relieve the hypoglycemia. So give thiamine, give glucose, treat the electrolyte imbalance, treat any comorbidities in the hospital. So that's all about delirium tremens. In delirious patients developing tremors, activating nervous system, and what do? You suppress everything by giving diazepams.